Hey everybody, Dr. Rob Silverman here. How are you? Thursday. Thanks for being so patient with us. Wasn't able to get in front of the camera on Tuesday or Wednesday. We had some normal posts, but today we have an outstanding topic. One that I think will really excite you, and one that you'll feel fulfilled with a lot of value. The topic sleep matters, the missing link to your health. And I can't emphasize the importance of sleep uh, any more than I'm going to try today. So many of my patients walk in and just can't get a good night's sleep. You know, we're talking right now, we're going through a health pandemic, an economic downturn, and people are stressed. And people are not getting a good quality sleep. People aren't sleeping ample and getting good quality sleep prior to this health pandemic. And most of the practitioners, I just did a webinar this morning in Europe, and most of the practitioners have admitted and agreed that they don't look at sleep enough because as a chiropractor, can I put my hands on you to sleep better? As a medical doctor, what can I give you other than a sleeping pill? And sleep's an interesting thing. There's many factors that go into a good night's sleep. But when you just think about it, as a great example, what if we have a young child, a growing child? What's the one thing that we want to make sure that they do? We want to make sure that they get a full, good night's sleep. Nothing changed when we become adults or they become adults. Everybody benefits from a good night's sleep. So sleep is vital. But as I've just indicated, it's often neglected. We don't look at it enough. We take it for granted. Hey, can we do an all-nighter? Can we stay up all night? Can we party and then go to work? Can we stay up and study the night before a test? And you know what? That never really worked that well either. Anytime I stayed up too late, and I was somebody who wanted to just keep studying and studying, certainly when I got to chiropractic school, it just never worked out really well. A good night's sleep refreshes you, gets that brain functioning better. Sleep is without question a component of every person's overall health and well-being. So sleep should be part of everybody's lifestyle. It should be foundation, lifestyle foundation, nutrition. Anything in functional medicine and functional nutrition should be all about sleep. Sleep's also important because it enables the body to repair and be fit for the rest of the day. So you rest. And while you rest, you also are able to recover. Rest, recovery, and I'll break it down to specific components thereof. Getting a good night's sleep also will prevent weight gain. Most of the people who gain weight aren't sleeping well because their hormones are set off. They're hungrier. They're going to want to eat more. It's shown that your neurotransmitters are thrown off without that good night's sleep. So sleep is a great opportunity to improve your body composition and actually enable you to be able to lose weight. It, without question, lowers the risk of heart disease. So many people attribute cardiovascular disease to lifestyle, but don't look sleep in the context of lifestyle for cardiovascular disease. Lack of sleep increases your illness duration. Multiple studies have shown that. So if you're sick, you're going to stay longer sick, or you'll be sick longer if you don't get good sleep. Sleep helps your brain work properly. I kind of shared that with you before. It helps your brain prepare for the next day. It's interesting. When you sleep, your brain detoxes. So your brain is like a sponge at night. It goes to 40% of its actual size and squeezes out all these different metabolic wastes and toxin. Your brain is also 10 times more active at night than it is during the day. Strange. It's different pathways. The microglial cells are working on an overload cascade at night. So you're really able to clean out your brain of all its waste components and waste materials when you sleep. So losing sleep doesn't allow you to get rid of those components in that debris. Those debris are usually called amyloid beta and tau tangles. They lead together to increase your incidence of Alzheimer's. You form new pathways to help you learn and remember information when you get a good night's sleep at night. Also, great book. Tom Walker has the best book on sleep. Strongly recommend Dr. Matt Walker. Great choice. Proper sleep or poor sleep alters 711 genes. Now, genes, as we all know, genes are not your destiny. You load the gun with the genes, you don't fire it, your environment fires it, and what you express is your epigenetics. Cycling back just a little bit, Poor sleep affects 711 genes. So how could you possibly have a good epigenetic outcome if you're not getting a good amount of sleep? It increases poor sleep, your incidence of stress, inflammation, immunity, and I want to emphasize immunity, and metabolism. You're able to refresh your immune cells and your immune system by getting a good night's sleep. So right now, immunity is at the top of everybody's consciousness without question. It's at the top of people's consciousness for the simple reason that COVID-19. So one of the first things everybody says, well, what can I take? What can I do? Get a good night's sleep. Also, it resets your body's circadian rhythm, naturally enabling you to go with nature and work with that. So I really believe that getting a good night's sleep will help you with your metabolism. Sleep and circadian rhythms affect the health and the diversity of our gut. That's a critical element. So by getting that good night's sleep, you have more biodiversity. More biodiversity in your gut really leads you down a path of good health. Biodiversity is a critical element. The more bacterias, good bacterias, and more diverse. Remember, diversity is your superpower. You're going to have good positive outcomes. Gut health determines our sleep quality. So let's look at it from the other angle. If you're taking care of your gut, taking your probiotics, taking your prebiotics, eating a good meal, exercising, making sure your gut is in tow and your epithelial cells, your gut lining is not leaky and it's in pristine condition, you're going to get better quality sleep. Caffeine. I was just talking to a good buddy of mine on the phone. We were talking about caffeine, and caffeine's half-life is 8 hours. So in that half-life, that 8 hours is very interesting in that a lot of people that have a cup of coffee at 2, 3, and 4 o'clock and they can't go to sleep. They don't understand their slow metabolizers of caffeine. There's some ways to get around that to really avoid those issues. Nevertheless, you don't want to consume caffeine, nicotine, and the like, any kind of stimulant late at night. Some people forget because, it's 9:30 and they're tired. They want to wait till 11, 12 o'clock. I see a lot of people drink, have an alcoholic beverage, 9, 10, and 11 o'clock. They think it relaxes them. Alcohol doesn't give you a better quality sleep. It'll put you to sleep, but it doesn't give you better quality sleep. If you consume too much alcohol where you can't detox it, then you'll fall asleep and get then you'll, if you will, pass out, no pun intended. Sleep and Alzheimer's, we talked about that. 1 hour, one decrease in hour of sleep leads you down a path of increasing precipitously your release of tau protein. So you really want to avoid that. Poor quality sleep affects hormones, regulating appetite. Many of your hormones, many of your neurotransmitters come from your gut and they go to your brain. So having said that, once again, sleep and your gut are intertwined. Poor quality sleep is also linked to a tremendous amount of inflammation. So me, as a practitioner who really wants to manage and modulate inflammation, finds it amazing that you can take blood. You can take your blood markers and you can really see that your blood markers, which are extremely objective, will indicate you that you have a bad night's sleep, and here they are. So basically you're going to have a lot of inflammatory markers in blood that you'll see elevated, like C-reactive protein, which is tissue inflammation, TNF alpha also. Interleukin 6. Interleukin 6 is the critical interleukin that leads you down a path of inflammation. That's the one that was most indicated causing an elevation in the cytokine storm. Endothelial 1 is actually the inflammation going to your endothelial cells or your arteries, which make them stiffer and not work quite as well. Good question, Mitch. Any compounds that you know that shorten the half-life of caffeine? Somebody's got a problem there, Mitch. It's great to hear from you. Thanks for the question. I greatly appreciate that. I'm going to hit you with a like. Yes. So I'm a big proponent in some different detox protocols. And some of those detox formulas will enable you to get the caffeine through. So a couple of easy ones: milk thistle, aloe. One of my favorite, of course, is glutathione. So you go through that pathway. That's a great question. Hey, Susanna, great information. Thanks, Doc. I greatly appreciate you reaching out and letting me know. I forgot to tell everybody, please reach out. Today's not been as busy as we had hoped. But feel free to ask a question, share it, please. You guys did a great job last time sharing it. It got a lot of feedback afterwards. Again, we always have that option of live, which is now, or Memorex, which is recorded a little later. Please share it, give the information. We work hard in preparing pertinent information. As I say in every live, I know it's really hard to find somebody who can trust. I'm asking you to trust me. I'm here for you. My goal is to be transparent with the information, let you know there's a place to go. I know times are a little tough. Hopefully we're coming out of it. You can ask me any question pertaining to health, and I'm willing to share or find somebody that can help you. Let's get back to it. Let's talk about concussion recovery. Everybody knows I'm big on concussion. I treat a lot of people with concussion. Concussion recovery, really simple. It's shown that people recover from concussion much better, have greater outcomes if they get good quality sleep. There was some misnomers of once you had a concussion, you shouldn't go to sleep and stay up. If you don't have a bleed, the literature is very robust on the side of getting good quality sleep. Interesting, women don't recover as well from men from concussions. They also don't sleep post-concussion as well as men. So if you have anybody post-concussion, try and start them on a protocol that incorporates good quality sleep. Interesting, sleep loss impairs what we call the blood-brain barrier function. The blood-brain barrier is that barrier that wraps around the brain that actually filters all the blood. It's sort of the doorway to the brain, or I like to call it the bouncer from the brain. The loss of the blood-brain barrier leads you to increased brain neuroautoimmunity and neurodegeneration. Those particular items or diseases are something like Alzheimer's, Parkinson's, multiple sclerosis, and the like. You want to get a good quality night's sleep to keep your blood-brain barrier in its unique, needed condition. Now, quality sleep can also help you maximize problem solving and enhance memory. So going back to what we talked earlier about taking a test, what a great thing to do the night before is to get a good night's sleep. And believe me, I got it. You know, when I went to chiro school, it was horrible. We had our finals week, and our finals week was all these labs. So every day we had 2 to 3, 4, 5 different labs. It was insane. And the next week we had all our written exams in 3 days because the teachers wanted to grade it on Thursday and give you grades on Friday and get out. Can't blame them. Nothing against them. So we had 8 to 10 tests in 3 days. It was terrible because it wasn't the one day that you take the test. It was you were tired. And then the next night you almost didn't sleep. And then the next night, I can remember freshman year not going to sleep. I was 30 years old. I went to chiropractic school a little later, already had a college degree. I can remember freshman year, the last night, not going to sleep. It took me days to recover. I will not do that again. Getting a good night's sleep is also going to maximize athletic performance. One of the biggest things that you hear the athletes, the college, and especially the professional athletes purport to is they need a good night's sleep. You know, they said the hardest thing is the travel. One of the things they've talked about now coming back in the NBA in a bubble is, hey, they don't have to travel. When they're done playing, they can go to sleep. They can go to their quarters. They have other things that they're concerned about, food and whatnot. But as far as getting a good night's sleep, they're able to get a good night's sleep. So I've talked about the issue. Now let me talk about some tips for getting a good night's sleep. One of the biggest suggestions is, without question, to maintain a regular sleep schedule. Try and go to sleep at the same time. When I say try and go to sleep at the same time, I'm speaking to the idea of, even though somebody like me travels, I see some questions I'm going to answer them in a moment. So, for instance, I'm in Eastern Standard Time. Everybody knows I live in New York. So when I go to this Central Time, I lose an hour. Mountain Time 2, Pacific 3. I do a lot of traveling in Europe. They're usually 5 to 6 hours ahead of us. That makes it tougher. Believe it or not, losing that time, going more east, going later, poses more of a health issue than going earlier. For whatever reason, it doesn't damage your circadian rhythm quite as much. So try and keep as close to a regular sleep schedule as you can. Susanna Diff, is using melatonin to help sleep bad for us? No. I think that using melatonin is a great choice, and 3 milligrams and or more is a great choice. Melatonin is a fabulous nutrient. It's great to decrease inflammation. It's also great to decrease oxidative stress, and it's great to enable you to sleep. Melatonin is, I'm going to talk about supplements in a second. Melatonin is the first supplement that I suggest. Mitch, any sleep trackers that you like from patients? Aura? Yes, I agree. Aura is one of my favorites. Dr. Peter T has done a great job. How do you use quantitative measurements to assess or change patients' sleep? The measurements that I've used are more blood markers, things like that, and gut markers. So I look at them all together. Vitamin D will be decreased if you don't get a good quality sleep. Inflammation will be increased. Cortisol will be increased. Cortisol's highest in the morning, but there's some people that have trouble with sleeping. It goes through the roof. I'm going to give you a slide, Stephanie. I'll put it in the links. It's a slide about the circadian rhythm and when melatonin works and serotonin works. Great slide. And it talks to you when you actually, at 5 o'clock in the afternoon is the best time in your rhythm to exercise. 7:30 in the morning is the best time to poop. All sorts of things like that. I'm going to share that. You've always used Alpha GPC for post-concussion protocols. Any others that you like? I like Alpha GPC. I find Alpha GPC will be coming out of the formula. It'll be a big announcement coming soon. Alpha GPC is great for concussion. Some of the other ones I like for concussion are pro-resolving mediators, taurine, also going to be a great sleep protocol, L-glutathione, turmeric, and omega-3 fatty acids. Maymay, she craves carbs if she doesn't get enough good quality sleep. Yes, you're going to crave carbs because the neurotransmitters are going to talk to your brain, and you're going to have an unleveling between ghrelin and leptin in your brain. Some more tips for getting a good night's sleep. Finish eating about 3 hours before you go to sleep. I'm a big proponent of time-restrictive eating, intermittent fasting. So having said that, try and be done 3 hours before you go to sleep, and try not to eat too much sugar, and certainly not too much sugar later in the day. Exercise regularly. Exercise is without question salubrious for everybody in that it's so health promoting. I said this before, avoid caffeine and stimulants before you go to bed. Interesting. Sleep on your side. So let's talk about positions now. Positions for sleep. Face down, no bueno. Face down isn't any good, and the reason that face down isn't any good is very simple, in that when you sleep face down, it locks up your lower back. I can't tell you how many people said they've slept face down, and guess what happened? They slept face down and they came in to me in one of my chiropractic services because their lower back. Sleeping on your back is fine. One pillow. I want to make that a big point. One pillow on your head, on your side. If you sleep on your back, try and keep your knees bent. Sleeping on your side is your best position. Once again, one pillow. And sleeping on your left side has shown to increase brain detox the most. Left side. Got a little shout out from Mitch Shooks. Fantastic info. Thanks again, Doc. My pleasure, Mitch. Let me hit you with a like. I really appreciate your time and your support. You do a great job down in Michigan. You want to put down your electronics. So get off the phone. Don't be playing with your phone before you go to sleep. Don't have the computer up before you go to sleep. Pass on that. That blue light is not good for you. Sleep on a firm mattress. I agree. Sleep on a mattress that has open foam. And open foam, this way it can contour to your body. You won't get any tender or trigger points. That's a critical element. There's a particular company we work with that has no flame retardants. And let me make that clear. You spend a third of your life sleeping. And in that third of your life, you're sleeping in your mattress. And there's flame retardants in your mattress. There's flame retardants in your mattress because since the 50s, the tobacco company got to the government and people were sleeping and smoking in a bedroom. They fell asleep with a cigarette and there was a fire. Well, obviously nobody in my household smokes, and I think smoking has decreased since then. But what's been left and the residue is that there are flame retardants in the mattress. So if you guys are interested, reach out to me. I'll tell you how you can get them. We've got somebody that we work with, but you want to sleep on an open foam mattress that has no flame retardants, so you're not exposed to all those toxins. Let's talk about some of the supplements. Oh, yep, left side is still the best. Left side's still the best. Absolutely. Let me hit you with a like on that. Supplements that can help. Melatonin, we talked about that before. Melatonin's a great, don't be afraid of melatonin. Melatonin's needed to get good, deep sleep. Taurine. Taurine decreases your incidence of neural excitation. So taurine blocks what we call the synaptic cleft. That synaptic cleft opens up, allows calcium in, and you can plaque in your brain. So taurine is a critical element. Taurine decreases what we call excitability. It not only does that, taurine also increases the release of bile. By increasing bile, you have a better gut health, and we all know that gut health is critical, or one of the components to allow you to sleep better. 5-HTP. 5-HTP is a great precursor for serotonin to make melatonin, your own method of making melatonin. Lemon balm and passion flower are great herbs. I just want to see if you have any more questions as we wind down. They're great herbs to help you relax before you go to sleep. So once again, I'll be on tomorrow at 1 o'clock. Very excited got a great topic to share with you tomorrow. I'm looking for some feedback. I want everybody to reach out, let me know what they'd like to see me talk about. I want you to continue to share it. I do greatly appreciate it. Thank you so much for your time. I look forward to sharing with you. Please remember, Dr. Rob, always yours in health.